Today on an all-new Dr. Phil. One big mistake happened the moment schools were closed.
Teachers' unions started to hold children's education hostage.
We were doing what we thought was right.
The damage we did to these children psychologically and in terms of their schooling will cost them life years.
5.53 million years of life lost for this generation of primary school kids.
Correct.
There are things that can be done about this. Okay, now you may be wondering, why are we still talking about the pandemic? I mean, it's over, right? I mean, we're back in school, we're back going. But I've got some questions for you before we even start. And if you're at home thinking, why are we talking about this again? I don't want to talk about it. Yeah, you do. You need to really listen to what's going on now because it affects you, it affects your family, it affects a lot of what's going on from now forward that I think is really significant. And I'm curious, how many of you think the pandemic was handled really well? Raise your hand. God, you're so judgmental. Okay, how many of you think, no, not so much. I don't think it was handled really well. Okay, so a lot of people don't. Let me start with you. What's your name?
My name's Jeff.
Jeff, you think it wasn't handled really well?
That's correct, yeah.
Why?
I just think there were so many unknowns that maybe we could have taken a different approach and got to the bottom of more things. Granted, it was an unprecedented event, so there were so many variables, but maybe we could have done things differently.
Yeah. Do you think the messaging was good?
It's a
The
tough
information that was coming out, do you think that was handled well?
I think there was so much combat about the information. There was such a black and white with a lot of distrust. So that maybe could have been handled differently, yeah.
Was it politicized?
Oh, it was definitely politicized, yeah.
Yeah. How many of you agree with him that it was politicized? Okay, now, I'm really curious how you feel about that. We're talking about a virus. How the hell does a virus get politicized? Okay.
It was politicized because there was money coming down the pipe.
No,
So
money in
things.
politics?
Money in politics.
You're making that
Oh,
up.
I am making it up, right?
Yeah, of course. Money and politics go together. All right, who else?
I go back to like thinking about the mask. If you chose to wear a mask or if you didn't choose to wear a mask, it really told you where you stood politically.
Yeah. How many of you still have questions about, like, what the hell happened? How come we've gone generations without one, and now, boom, here it is? Is it over? Is it coming back? When's the next one going to be? I mean, are those still questions you have in your head? How many of you think that this was no natural phenomenon like the flu or shingles or scurvy like a pirate would get? How many of you think this was not natural phenomena? Somebody had to do something, not intentionally or otherwise, but just that somebody had to do something for this to happen. Raise your hand if you think that. Okay, raise your hand if you think, no, this is just kind of the natural order of things. People got sick. Okay, so no conspiracy theorists among you. Okay, well, we're going to try and answer all these questions and a whole lot more today so you can come away with some understanding. You say one big mistake happened the moment schools were closed. What was that?
Yeah. So, the decision to close schools was made quickly and summarily across the country. And when that decision was made, in February, around there, I felt like it was a reasonable decision to make because the truth is that schools are normally a prime vector for spreading viruses. You all know that. You have your kids in school, they get sick. And if someone's sick, all the kids get sick. And we also so there was reason to believe that kids would get it in schools, and we had no way of knowing how sick kids were getting at. So arguably, the decision to close schools was about keeping kids safe too, because we thought they could get very sick from this virus. But what I said at the time was, it's okay to close schools, but we need to make reopening schools our #1 priority. That schools should be the last thing to close and the first thing to open. And that's where I think things, from my perspective, got off the rails.
But the minute they closed the schools, they should have been planning how they're going to get them reopened.
Safely, absolutely.
And that didn't happen.
That did not happen. And even when we got enough information to know that transmission in schools wasn't as bad as we thought, that there were ways to make schools safe, even when vaccines came along for teachers to get vaccinated, many school districts didn't open. And I think the unfortunate reality is that children historically have not been a priority. Children don't vote. They don't make political contributions. People were talking about politics and money. And as a result, we were seeing many communities having bars and restaurants and tattoo parlors open and schools closed. And for me, that was shameful.
What was incorrect early on?
Well, I think the first real mistake that was made was the assumption that this was SARS-like. And it was immediately classified as being a SARS-like pathogen. And then that defined the public health response, because we had developed public health responses for both SARS and for a sister virus that we call MERS. But it never learned how to go human to human. So at the end of that original SARS outbreak, there was less than 1,000 people infected. And this virus immediately was, in my view, and I'm a virologist by training, it was the second most infectious virus that I know of. We identified 14 people in January and early February that had this new virus called COVID. And we evaluated a little over 800 contacts. And we found that only 2 of those contacts actually had COVID. So that would allow you to conclude this virus isn't very infectious, like the Chinese were saying. But the way that we evaluated those patients, we evaluated them for symptoms. We didn't evaluate them for infection. We rapidly learned that this virus was nothing like SARS. It was largely transmitted human to human very efficiently and largely asymptomatically. So our whole public health response was triggered by that premature classification of this virus being SARS-like.
Okay.
We shouldn't have jumped to that conclusion.
Should the schools have been shut down?
I didn't believe at all. I thought that what we should have done in general, and you could go beyond the schools, the economy, we should take a pause, and as I heard some of your guests say already, step back and say, how do we continue this in a safe and responsible way? And I tried to argue that I thought more public health damage was going to be done to kids K through 12 by closing the schools.
Dr. Christakis, let's quantify the impact of this. How many years of life lost do you believe are in play here because of these primary school closures?
Well, so the study we did assumed that we make no changes to rectify the damage we've done to kids.
Right.
We lost a lot of people to COVID, as everyone knows, in the United States. Most of them were elderly. And in fact, on average, what was lost per adult who died with COVID was about 10 years of life. Because if you're 70 or 80, you have about 10 years left. We lost very few children to COVID in terms of them dying. So most people thought, if you looked at it in terms of lives, right, these kids are fine. They're alive. We only lost a few hundred of them. And we lost millions of adults and millions of life years. But the problem is, and Dr. Redfield alluded to it, that the damage we did to these children psychologically and in terms of their schooling will cost them life years later in life. So, for example, what we did in the study was use third grade reading levels. Well, it's the single best predictor of high school graduation. So if a child doesn't read at grade level at third grade, 25% of them will not graduate. A low-income child not reading at grade level at third grade, only 1/3 of them will not graduate. Why is that? It's because our educational system, up until third grade, teaches kids to read, and then from third grade on, we expect them to read to be taught. But what's going to happen is that these children are not learning to read, and high school dropout rates are going to go up. They already are going up. Junior college admissions are going to go down, and these children will have lower paying jobs and shorter lifespans. And we tested that. We did these 2 models. I know I'm giving a lot of details here, but the bottom line is what we estimated was that there's a 99% chance that more life years were lost by closing schools than by keeping them open. These are life years not today, but life years of the children today are going to have shorter life expectancy.
And you quantify that to be how many years of life lost?
It's a model and there's ranges, but millions of years of life lost versus hundreds of thousands years of life lost that we lost.
Let me start with you in the back, ma'am.
I'm Colette Dryden from South Carolina,
Uh-huh.
and I'm a retired teacher. And I retired shortly before the pandemic, not knowing it was coming. And I can assure you that the teachers, it's harder for them to teach remotely than it is. I had many phone calls from my former colleagues during this time asking for help in teaching remotely. They were trying very hard to keep their kids up to date. They were not trying to get federal dollars. They were not trying to, and we're not politicians, we're teachers.
You know, I am a teacher advocate.
Yes.
I don't know a teacher that doesn't get in their own pocket to buy materials for their schools. And I just fear that they're ever going to do the math and figure out what you're making an hour for the time you put in the classroom. So God bless you for the things you do in the classroom. We're not talking about the rank and file. We're talking about the politics that go above it. What do you want to add?
Well, yeah, I mean, I want to say, speaking as a physician, I think teaching is the most noble profession of all. I mean, I want to be clear about that. I mean, they do God's work. They do it for way less money, and we need them, and we don't value them enough. So I want to be very clear about that. I also think they're essential workers, and I think we have to recognize that. I mean, I was called an essential worker as a physician. We were given PPE. Teachers should have absolutely been given PPE. They could have been in the classroom safe. No one, certainly not I, am saying they should have gone into an unsafe situation. We should have made it safe for them as soon as possible. And then I want to respond to the big mama problem, as you called it, because that's a real thing. And I don't think we should take that lightly. We need to protect Big Mama, and we need to help her child or grandchild get an education. We have to be able to try to do both. If we sat down with parents and said, your children's schooling is something, because I know Big Mama wants her grandchild or her child to get a good education. I know she wants that.
Right, and she does. And if you don't mind, Dr. Field,
No, please.
just a quick response. I think you hit the nail right on the head in the fact that we were not prepared to open the schools up, because it's almost like you're asking teachers to go into an unsafe environment, a little mini super spreader,
Right.
Where these kids could actually infect the teacher. They didn't have PPP. The buildings were not equipped at the time, and that's why the money had to come down the pipe, right? And in order to prepare to open this thing up, this was a very new situation for everyone.
Right.
What do we need to do to close the gap for America's elementary school children who have 5.53 million years of life hanging in the balance because of this disruption of their learning? Can we recover? How do we make sure this doesn't happen again? What does each community need to do? And what questions do parents need to ask their school districts right now? And will there be another pandemic in our lifetime? Will we get to the truth and get you the answers? I certainly hope so. Do you have a story or a question for me? Click the link in the description and tell me what in the world is going on.